been on an elective this month, which is a nice month of sort of semi-unstructured time where I get to go, and this month I focused specifically on my interest in radiology. And so we're over at Tufts Medical Center with the radiology department, particularly the interventional radiology department, sort of learning about and observing minimally invasive procedures.
That sounds like a blast.
There's good days and bad days. I mean, some of the procedures are pretty interesting and some are pretty dull. And so I'm doing my best to sort of cherry pick among the better ones.
So have you been not physically here then?
No.
Tufts, you mean like in Boston?
Tufts in Boston, yeah. So I've actually been in Boston this past month mostly. And then I come back here once a week for my afternoon clinic.
Oh, and that's when we just happened there.
Yeah, that was me. You just happened to catch me. I get to be there in 5 minutes. So.
What is clinic?
It's just what we do after we see patients in the hospital. There's usually a certain amount of follow-up that a lot of them require. And so if they don't have their own primary care doctors at home or wherever they're from, then we can schedule them to see one of us residents in our clinic. And so we favor seeing those patients that maybe don't have insurance or aren't really well plugged into the healthcare system. My pager's been off the whole month. That's pretty nice. And let's see. Yeah, and if it's sort of an uneventful day, there's a lot of time. A lot of my month's been supplemented with reading. There's a lot of reading for radiology that I want to get done this year. And so anytime I have, a free half day, it's a good chance to sort of bang out a chapter here and there. And then at the same time too, during this month, I mean, we've had some household emergencies come up. The dishwasher was leaking the other day, so we had to call a plumber and take care of that. And luckily for me, being on a month of elective, I did have the flexibility to actually be present for the plumber. Otherwise, I can only imagine what it would have been like on surgery or on the wards, where weeks probably would have gone by before we would use the dishwasher or have the plumber come out.
You ready for anything?
Just ready for anything. Yeah. Got to get my edge back.